Good morning, everybody. It's early. I love early mornings. Yeah, so the whole point of Jilly Juice is to understand why things exist in the medical holistic industry, why things exist in the medical industry, and then why things kind of segue into the holistic industry. And in order for us to understand Jilly Juice and why it's so important, we have to understand why vaccines exist. We have to understand why antibiotics exist. We have to understand why medical procedures exist. And if we don't understand them and we demonize them, then and I'm saying we as all of us, we will fail to understand then the right chemistry to override all of the things that exist at this point. Why would we want to override it? Because the end result is death. But that's if you even want to entertain the thought that you can live indefinitely and that you can reverse the death process. And how could a person even entertain that? I mean, who in their right mind would entertain the thought that you could reverse death, that you could reverse aging? And so what would it take for a person to even think that? I mean, it could take a crazy person, as some people call me crazy, or it could take someone that understands the element, understands the human body, sees the major significant difference in herself, and then realize that myself is no different than anybody else out there, except the fact that we have just a different background, but it's all under the same world. I mean, we're under the same dome of sky. We're all in the same universe, dealing with the same elements. We have the same 11 different systems. I mean, even though people think that they're alien, that's just another fallacy out there. Every single human on this earth is the same, except for a few minor superficial differences that have turned into major differences and has caused wars. Okay. So once, you realize that everybody's the same and we're dealing with the same periodic tables, exposed to the same elements, just a different manifestation of them, but you still have the same immune response, the same stimulus response, then you start breaking down everything. And that's what we were doing with Jilly Juice, is understanding why things exist, and then where does Jilly Juice fit in, and then it's then about balance. And that's one of the hardest things, one of the biggest things that I've come to terms with, is that I have to give credence to things I used to demonize. And it does take where you have to kind of swallow your pride, swallow your ego, and be like, okay, all right, maybe I was too extreme here. I mean, when I had to change the wording on my business page because the Federal Trade Commission was like, no, you can't say this, you can't say that. Oh my God. I mean, at first I fought it. Okay. And when I was talking to the FTC, I was just like, but I can do this, but I can do it. And they're just like, dude, you're not a doctor. You have to go through, but they were coming from the standpoint of that I was trying to propagate a cure, which really actually technically was not so, though I was speaking in that language. The actual technicality of Jilly Juice is not a cure, but I had to understand that. I had to actually pull back and say, okay, I can't say this because it's fitting into the world of medical biotech, where you have to get things FDA approved for you to say that it can cure a specific disease. So I understood in all the loopholes I had to deal with. I mean, Facebook and YouTube, you can say a lot more stuff than you can say on your own business site. So people think that Facebook and YouTube is censorship. Actually, no, you get a lot more freedom on social media than you would actually get in advertising. Okay. So that's why I don't buy into the whole thing with the censorship. Yeah, they're going to stop people from talking about certain things because it causes then a major uproar in the actual physical world, because people do take information on Facebook and on social media and they take it way too seriously, and then it translates into the physical world. Okay, but anyways, I digress. My whole point now is to understand antibiotics, why they exist. And we have been demonizing antibiotics, and for rightfully so, because it's been overused. Antibiotics at this point, well, it's being used as an anti-inflammatory. Well, why are they stopping the healing process? Because that's what inflammation is. It's healing. Well, yes, it does stop the healing process, but the medical holistic industry is afraid of sepsis. They're afraid of too much of an inflammatory response, and they're afraid that people who are already weak. So that's where the thing with the balance comes into play. And this finally clicked with the thing with sepsis, because sepsis only targets the very, very weak, which is the babies and the elderly, as well as the immunocompromised. Those are dealing with diabetes, those that survive a sepsis shock, those that are diagnosed with some kind of chronic condition. And so I understand now why antibiotics and why anti-inflammatory responses are so popular, and why Dr. Phil and why Jeff Holiday, and we're all like, tripping out on the whole thing with the J juice, and why I was like demonizing antibiotics and demonizing the medical holistic industry. And they were coming from the standpoint that everybody, is so weak, which it's true, they are, but not everybody is weak. Some people, well, here's the thing. I'm not saying don't do antibiotics, but I'm saying don't do antibiotics if you have J juice. If you don't have J juice and you don't do antibiotics, yeah, you could suffer a tremendous sepsis attack, because we don't want something left untreated, because then that could lead to, based upon your predisposition, a sepsis type situation, which we don't want to have anybody having too much of an inflammatory response in their blood to thicken it up and then cause heart attacks and strokes where you don't survive them. Okay, so now we must understand when it's about balance. It really is. It's about balance. But what does that even mean? Because balance, we say balance, it's like vague, because it's based upon the context and what you're referring to. So we have to understand why vaccines exist. Now, for me to even get across why Jilly juice exists and why Jilly juice is so amazing, is to understand why vaccines exist, why antibiotics exist, and then why the medical procedures, like some of these, the Whipple procedure in pancreatic cancer, where they are removing certain parts of the body in the pancreas to prolong someone's life, but why you'd have a higher why would you have a survival rate with the Whipple procedure in pancreatic cancer is based upon where the cancer doesn't metastasize. It doesn't get to other organs. So if you catch anything early enough, no matter what it is, you could buy yourself 5 or 10 years, potentially. But that's like with anything. You catch anything early enough, you'll have a higher survival rate. It's when people don't catch things early enough, they don't listen to the indicators, and then they try to apply antibiotics, procedures, cannabis, chemotherapy, and it's too late. But what if we didn't have to worry about catching something early? What if that, no matter what stage, as long as you understood the process, you could actually reverse that issue, but you have to go through pain. And that's the whole thing with the J juice. I'm not saying that in lieu of all of those procedures, if it's medically necessary, that you don't do it. Of course you do it, but you do J juice at the same time. But we have to understand then why vaccines exist, and why right now the anti-vax community and the anti-government people are going to bring people back to the caveman days because of sepsis. Now, what they're going to do is these which now I understand why the anti-vaxxers then go to all the antibiotics in lieu of the vaccine, is because that's how they stop the inflammatory response from the exposure to that virus in the environment. But what they don't realize is that when you apply chemistry that they don't know how to dose, and they don't know their child's predisposition, they don't know really what to do with these anti-inflammatories, like these natural remedies like garlic, turmeric, and kombucha, then they could potentially actually put their child in more danger by altering their biochemistry and causing more imbalances, which then leave them open for another virus to go in and potentially cause sepsis. Because but sepsis is when you have too many white blood cells that then get into the body and into the bloodstream. And then that's when then organ shutdown and organ failure happens. And it happens a lot in kids as well as the immunocompromised and the elderly. And so that's why vaccines are recommended for the children, for the immunocompromised and the elderly, because of how weakened their immune system is. Because if they were to expose themselves to a virus, that virus in the environment without some kind of layer of protection, to what the vaccine does, it slowly brings up an immune response. Or some people think it's like really fast, but it does bring up an immune response. So you have a layer of protection. So when you do get exposed to that, you already have that layer of protection, and you won't be building up so many antibodies so quickly that could overtake a body. So this is what the anti-vaxxers don't realize, is that when, feeding your kid antibiotics every single day to stop, an immune response will also do more harm than good, because then you stop the body from reproducing good cells, you stagnate the growth process, and you leave that child open for more disease because of the amount of antibiotics you're feeding him, because you're so afraid of Ebola. I mean, this is going to be a classic predictability when you see them talking about, suggesting the Ebola vaccine when it finally becomes more mainstream, not just a conspiracy or part of the fear community of the anti-vaxxers. When you start seeing it becoming like, hey, Ebola's on our soil and we suggest you get the vaccine, especially for these people, those that are in the medical industry or those that are in, caring for people, we suggest you get the Ebola vaccine. And then you're going to see people start shoving antibiotics down their kids' throat, and not just like the ones like in the hospital antibiotics. They're going to be shoving turmeric and garlic and apple cider vinegar and kombucha and elderberry syrup and all that down their kids' throat, causing more imbalances, because they're trying to stop the inflammation from the potential exposure to Ebola or some other type of virus. Okay, so the vaccine isn't supposed to make you healthy. I mean, it's supposed to introduce you to an environment that preemptively that you're going to be exposed to anyways, but it does give you a slower immune response versus when you get exposed to something that you're not used to. And it's like getting a blood transfusion, the wrong blood transfusion. When you have so many antibodies built up at once, and that's like infection, when you have so many antibodies that are building up so fast and so quickly. And that's what people get scared of with the J juice, because they see an immune response happen with the J juice. But what's going on is that you're bringing in electrolytes. You're already bringing in electrolytes, and the body is working simultaneously, bringing up white blood cells. So you do get an inflammatory response, but you also have the support of the electrolytes in the background and the nutrition to keep the balance. So even though your body is working in inflammation and it's bringing up white blood cells, the people that get afraid of that's going to cause sepsis and cause thickening the blood. No, the electrolytes is what actually balances out that inflammation response, so it doesn't thicken up the blood to then cause potential organ failure. Okay, so that's why J juice has been so amazing for everybody, that in all types of conditions, because the electrolytes and the nutrition and the probiotics is like, I want to say a cure-all, but it is the most prevalent, most common component that the medical holistic industry uses to stabilize people who are dealing with an imbalance, like an emergency imbalance. When you go to the ER because of dehydration, they put you up to an IV bag and start pumping in electrolytes and glucose in you at a very fast rate. And some people go through like 4 or 5 bags in a few hours. Okay, some people go through 2 bags in a couple hours. So this is giving you a real technical understanding why vaccines exist. Now, why people get adverse reactions, because predispositions, and they're already weak. Okay? If you don't want to get any adverse reaction to any virus or bacteria in your environment, you have to strengthen your weaknesses. But you can't tell somebody who is so used to a lifestyle, so used to a predisposition, has accepted that death is somewhere in their future. You can't tell them that, you know what, maybe you don't need to die, maybe you don't need to have these predispositions, maybe you don't have to experience what your parents experienced. You can't change somebody's politics that way. You can only cater to their choices in life, stabilize them the best you can, and then you hope to God they survive the procedure. But then, you know, we have so many weak people on this planet going for these procedures, and they're not surviving them because they're that weak. And then inevitably, that system, that medical or holistic industry does get blamed for the death rate. But it was already in you already were predisposed, you already have weaknesses. There was like a 20% chance that maybe you would survive a procedure in the medical, the system, and you just happen to be that 20%. But there's like 80% that survive, but you happen to be that 20%, but you think that's like 100%. The 20% doesn't care that they're part of the 20% because they think that because they didn't survive, which is kind of weird, you know, how would you know what a person thinks if they didn't survive? But their loved ones are like, well, my mom got this chemotherapy, or my dad got this thing and he didn't survive. And so I went on to this cancer, or this pancreatic cancer article, NBC, and they're talking about, I guess, what is it, that representative that dealt with, you know, the 1960s, I think it was John Lewis, that's his name. He is dealing with pancreatic cancer now. And so I just copied and pasted, because people were talking about like the Whipple procedure and all of this. And I just copy and paste something that was said through Medical News Today or some mainstream article talking about the percentage rate, success rate of Whipple procedure. And then you can see just every comment. My dad survived, or I survived. No, somebody died from that. No, and I just copy and paste whatever was written from the CDC or something. And inevitably someone already argued my information, and I got it from a mainstream article from freaking the actual, biotech. And it's true. I mean, if you catch anything early enough, you're going to survive it. But if it's like stage 4 cancer and it's metastasized, the Whipple procedure is not going to work. But that's like with anything else. Chemotherapy, you catch it early enough, you'll survive it. That's why you'll see people say, I survived chemotherapy, I didn't. I survived cannabis, I didn't. I survived the Whipple procedure, but I didn't. Okay? But people think that, if you don't survive, that no one's going to survive. Well, that's not true. You catch anything early enough. But what's going on is that people catch things early enough too, but they have so many other predispositions that they don't have enough support in their other organs and other systems, and they still pass away from the disease. So anyways, let me read this about sepsis so you understand the bigger picture. Because this makes total sense why the holistic industry exists and why they promote so many crazy antibiotics, because they're trying to stop sepsis. But they don't realize that the devil is in the details, and they don't know the biochemistry of their people really. And so when you're applying so many antibiotics or remedies or excess acid like kombucha and apple cider vinegar, it actually causes more malabsorption. So the malabsorption rate becomes higher from the antibiotics and the remedies, and then the potential to trigger more conglomeration exotic diseases is far greater. Okay, so according to the National Institute of General Medical Science, over 1 million people in the United States develop severe sepsis each year, and 15 to 30% of these people die as a result. Other studies estimate that sepsis may contribute to over 250,000 deaths every year. And so what is the death rate of sepsis? Patients with severe sepsis or septic shock have mortality rate death of about 40 to 60%, with the elderly having the highest mortality rate. Newborns and pediatric patients with sepsis have about 9 to 36% mortality rate. And then each year, at least 1.7 million adults in America develop sepsis. Nearly 270,000 Americans die as a result of sepsis. Is death from sepsis painful? If caught early, okay, that's the key words, guys. why people survive all these different procedures, why you can't knock chemotherapy, why you can't knock cannabis. You know, that's your mode of curing or your mode of medical stuff. If caught early, sepsis is treatable with fluids and antibiotics. Well, what are fluids? Fluids are electrolytes. See, when you read the word fluid, people think that's just water. No, fluids are electrolytes. If caught early, sepsis is treatable with fluids and antibiotics, but it progresses quickly, and if not treated, a patient's condition can deteriorate into severe sepsis with an abrupt change in mental status, significantly decreased urine output, abdominal pain, and difficulty breathing. So you'll never deal with sepsis on Jilly juice because you're going to be major urine output and you're going to be water falling and you're bringing the electrolytes to offset the antibody accumulation. So if you have infection and if you have inflammation on the J juice, okay, don't worry about sepsis. It's not going to happen to you because you're bringing in the things that they use to stabilize, which is the electrolytes, okay? When is sepsis usually fatal? When sepsis strikes, it can be fatal, with estimates suggesting it contributes to 1/3 to 1/2 of all in-hospital deaths. People with chronic medical conditions such as neurological diseases like MS, autism, Parkinson's, ALS, diabetes, okay, cancer, chronic lung disease, and other kidney diseases are at a particular risk for developing sepsis, and it is fatal. Okay, what is the average hospital stay for sepsis? How long you stay in the hospital depends on how many factors. The average amount of time to stay in the hospital with sepsis is 6 to 9 days. Can you have sepsis and not know it? The signs and symptoms of sepsis following a bad infection are often subtle and can be mistaken for those of other serious conditions. However, sepsis typically involves the following main features in someone who has a recent infection, and symptoms can come quickly. Well, let me read this. What are the main features? Don't try to diagnose this at home, okay, guys? When you have a major infection, you're not doing J-juice, call the hospital, please. Call the ER. So these are the symptoms you would experience if you're in that scenario. Fever, high temperature, pyrexia, there may be chills and shivering, fast heart rate, pulse, tachycardia, rapid rate of breathing, tachypnea, unusual levels of sweating, diaphoresis, dizziness, and feelings of faintness. That's when you call an ambulance, okay? Confusion or a drop in alertness or any other unusual change in mental state, including a feeling of doom or real fear of death, slurred speech, diarrhea, nausea and vomiting, severe muscle pain and extreme general discomfort, difficulty breathing, shortness of breath, low urine output, not needing to urinate for a whole day, for example, skin that is cold, clammy, and pale and discolored or mottled, skin that is cold and pale at the extremities, signaling poor blood supply, poor perfusion, loss of consciousness. So when people eat edibles, like with marijuana, and they feel like they're going to die, guess what? That's like a sepsis situation. Okay, if someone eats like an edible, like a marijuana cookie, and it's too much for the body, either they'll feel like they're going to die and they have all of these characteristics and they call the ER and they go and get stabilized, or they go and throw it up. One of the two. And if you have a very weak body and you don't throw up, but you have all those characteristics, or you do throw up, one of the two, you know, and you already have a weak body. All right. Okay. This is why you have to watch out for the cannabis stuff, the edibles, because they cause what you would say a triggering of a sepsis, because that's too many antibodies coming in at once. Like, it's like a deluge. It's like when an army just overtakes. Okay, it's like if you have 1 billion people in China all band together and just overwhelm the US. That's what sepsis is. That's what inflammation is. But if you have the right balance of electrolytes, then you won't suffer an organ shutdown because of the amount of antibodies that are being produced. Okay? Why is sepsis so common? Many types of microbes can cause sepsis, including bacteria, fungi, and viruses. However, bacteria are the most common cause. So that bacterial infection of that Navy SEAL, he didn't bring in enough electrolytes to help offset the amount of antibodies, and he already had weaknesses because he couldn't heal from that infection because his body was already compromised. See, you wouldn't have infection at all. You wouldn't have pneumonia. You wouldn't have any bacterial infection or any respiratory infection if you had an actual strong body. Infection comes from a weak person. So when someone has walking pneumonia, they have, bronchitis, all these types of viral diseases, is because they have a weak body. It's causing infection, causing an inflammatory response, and then the medical system goes in and tries to monitor that inflammatory response with an anti-inflammatory, but you're still dealing with weak people who will then have a chain reaction of other issues because of the amount of antibiotics to stop the inflammation. So you need a certain amount of inflammation if you have a weak body, but too much inflammation can cause then sepsis. But then if you don't get to the inflammation fast enough, then that healing hormone, those antibodies, could also do you in. So you still need to bring in, this is why the J juice is so important, is because you're bringing in not only the electrolytes to help disperse the antibodies, but you're also fixing the weakness with the micro and macronutrition, the lactic acid, okay, and then the electrolytes in the water and all that stuff. Okay, so it's not just electrolytes. I don't want people thinking like, oh yeah, I'm just gonna drink a jar of Pedialyte or a bunch of Pedialyte to offset any. No, because if it was just fluids alone, which is electrolytes, then that would be the cure-all. The hospitals would be curing people left and right, which they are, but not all the time. But we wouldn't have to go back to the hospital to get rehydrated with these IV bags. It's more than just electrolytes, but that's the component that's in the J juice that is also being used out there to stabilize patients that have sepsis type characteristics or need rehydration. So who is prone to sepsis? Those at the highest risk of developing sepsis includes the very young and the very old, infants and seniors, as well as people with chronic or serious illnesses such as diabetes, cancer, and those who have an impaired immune system. So those that have a diagnosis of autoimmunity, that Raynaud's, lupus, fibromyalgia, diabetes, any other chronic condition that you're under a doctor's care, or you've been diagnosed and you've kind of kept it in remission, and so you're not under any kind of prescription drugs, but you have a very modified diet. As you get older and as you go through life and you cut yourself or you trigger some kind of condition in your body because you have predispositions, you all are prone to a potential sepsis type of thing, and inflammation. And what happens is when you start feeling inflammation, you start taking an antibiotic, which, okay, stops the inflammation, stops the rapid development of the white blood cells. However, it stops the healing process, and then it leaves you more open to then another chain reaction of other types of diseases. So, I mean, the cures out there could be the cause of the reason for the cure. Okay? That's essentially where I'm coming from, is the cures are now becoming the cause to get a cure. So what is a leading cause of sepsis? In addition, chronic illness such as diabetes, kidney disease, cancer, high blood pressure, and HIV are commonly found on those who have sepsis. The most common types of infections to cause sepsis in seniors are respiratory like pneumonia or genitourinary like urinary tract infection. Okay, so when you already have an immunocompromised body, and then you already have weaknesses. So some people can have co-infections. Have you heard of co-infections? Where you have EBV virus complications and another virus complication and another virus complication, and you have multiple infections in your body, you are at risk of sepsis. And then people are like throwing antibiotics at themselves. And then of course the body becomes immune to that. And the anti-inflammatory or the inflammation response becomes even more so, because the body is then saying, hey, we're going to be immune to that antibiotic. They're going to adapt to it, so it doesn't work anymore. You can't stop the inflammation response, and the body will still then bring up inflammation. And then that's when people see situations. And what happens then, here's the thing. Then I asked Google, can you die from a heart attack from sepsis? And guess what it said? According to a study published last year, sepsis survivors have a higher risk of having a heart attack or a stroke within 1 month of their discharge from the hospital. And if they don't survive, well, if they have too many weaknesses, okay, then they won't survive the heart attack or stroke. If you survive a heart attack or a stroke, you have enough electrolytes in your body to push that blood through to get to the vital organ like your heart and your brain, but you may not be so lucky the next time. Very rarely does someone survive the second heart attack or third heart attack, because it means that their body didn't get what it needed. So the first heart attack or stroke is like saying, hey, a red flag, you have electrolyte imbalances, you have malnutrition issues, you have major issues, and we're going to give you a pass on this one. But if you don't change your lifestyle, which people do, they're like, okay, they're going to go work out. So some of them are obese that had a heart attack. Now they're working out, which, okay, fine. You may mitigate other issues that come with obesity. And yes, exercise and losing weight is a way to cure some of those conditions, but it doesn't get you out of the woods. You still have a risk for other infections. Your heart is still weak, okay? And so working out can also cause more issues. It causes more lactic acid imbalances, more other imbalances, other types of issues that then would cause a heart attack, a stroke that you may not survive the next time. And it also can cause sepsis, inflammation. Okay, so even the cures out there could cause the reason for another cure. So, I mean, so what else? I mean, is there anything else on thinking about sepsis? But this has you understand why antibiotics exist, but why antibiotics can also be a detriment. And so you have to understand the balance. So when you see me demonize antibiotics, which in a lot of ways I am, because I know how they're being used. They're being used as if it was candy. And they're developing more antibiotics because the body has become immune to some of these mainstream antibiotics out there. It doesn't work anymore to stop inflammation. So maybe you have to understand why inflammation happens, why it exists, why it needs to exist, and then what they use to try to manage the over-inflammation, where there's too much, like when you get a blood transfusion, a wrong blood transfusion, and then what they use to stabilize somebody. Okay, and they use electrolytes, but it's not just electrolytes alone. It's not even electrolytes and antibiotics together that can actually really save a person who's far gone. Now we got to take it a step further. It's electrolytes. You don't really need antibiotics, but okay, fine. But if you use that, fine. But it's also the probiotics, which is the lactic acid. It's also the micro and macronutrition that is broken down to a pre-digested state. See, why does cows have 4 chambers in their stomach to break down the grass? Because that's how you have to break down the vegetables, the grass, to get to the actual nutrition. So if a cow has 4 chambers in its stomach, but a human only has 1, you think that we're actually deriving nutritional benefit from the vegetables, when you already have malnutrition, you already have malabsorption, you already have major issues of breaking down your food. So even diet alone and all that is not going to change. It's bringing in something that breaks down the necessary foods, such as the cabbage and the kale, and then sticking to the diet. And I mean, if you can puree beef, fine. But people aren't putting beef in a blender. Okay. So that's why I say, okay, if you're going to do any kind of meat on the JJ's protocol, do the chicken. It's the easiest to digest. And you still get your animal fat, you still get a satisfaction, you still get your protein and all that stuff. But I mean, hey, if you can puree your filet mignon and do the JJ's, by all means. But I don't think that's the point of people who are carnivores, is to puree their beef. So, yeah, I mean, like anything, when you have an over-inflammation response and you already have imbalances in your electrolytes, that's where the medical holistic system comes in. Well, the medical system comes in with both antibiotics and fluids. What are fluids? They're electrolytes: salt, glucose, water, potassium chloride, magnesium, calcium. And that's what's in those IV bags. Okay, my dad used to work for a company called B. Braun McGaw that would actually create these IV bags, okay, for hospitals. And when I had that UTI, an infection, and then they gave me sulfa. I got an allergic reaction from the sulfa, which is a type of antibiotic, like a penicillin. And so when I got that allergic reaction, I was in the hospital, and they hooked me up to IV bags to break up the white blood cell count because I was getting little red rashes all over my body. Okay, so this now clinches it. I mean, now we understand why things exist, why vaccines exist, why the antibiotics exist, why the medical system exists, why holistic people go way overboard with antibiotics, and why that also does more harm to their kids and their family. I understand anti-inflammatory responses, but you need inflammation, but you need to have it supported by the Jilly juice. So go get your vaccines if they come mandatory. You don't have to do a vaccine if it's voluntary, but do the J juice. Don't do nothing at all. Don't not do a vaccine. Don't not do J juice. Because some of you are sitting ducks. Some of you have so many predispositions, you can't afford to be exposed to some of these viruses out there. And believe me, you're seeing people who are exposed to these viruses that are completely unprotected, and they are suffering because of it. Or they're throwing elderberry syrup and Mucinex and all this stuff that you see, Theraflu, which is suppressing the symptoms, but then leaving them further weaker, leaving them open for another chain reaction of issues. Okay, so so there is like a very complete understanding of why J juice, no matter what, whether it's vaccines or antibiotics or prescription drugs that you're on, J juice will always be that underlying support, because it's what they use to stabilize people when they do get an overabundance or a major imbalance that causes them to be hospitalized or go to the ER or whatever. All right. Happy New Year, guys. Bye.